Let's go inside the V2 QBank and do some pharmacology questions. These are hard, so we're going to work through it. Okay, question 1. A female client is diagnosed with heart failure and also has developed diabetes mellitus type 2. To control her diabetes, the nurse knows the client needs to avoid. What do we have for her here? Oh, okay. A list of medications. Exenatide, glyburide, neglinide, and pioglitazone. Now, you might not be familiar with these, so let's see what we're trying to prevent. We're trying to prevent, is it urinary tract infection, fluid retention, pancreatitis, or lactic acidosis? This is where you want to start because we need to go back. We've been given a clue. The client has heart failure. So which one of these are most related to heart failure? We want to prevent the fluid retention. Forget everything else, all right? So we know we have that connection. Now let's look at these medications again, and let's try to see if we can figure this out. So this is going to come down to which one you don't know, all right? Because you know exenatide, glyburide, neglinide, these are used commonly for diabetes mellitus type 2. So I'm going to go with the pioglitazone, and I'm going to pair these two together. So let's check our answers. Yes, okay? And this is an example of how you should work backwards for some of these drop-down close questions if you're in the V2 QBank, because you can get a lot of information that way. Read the rationales on your own. Question 2. The nurse monitors a client taking lithium carbonate for signs of toxicity. Select 4 signs of lithium toxicity. So I know lithium affects your mentation. So I'm going to be looking for, I think definitely the drowsiness, confusion, blurry vision. I'm expecting those things. Drowsiness, confusion, blurry vision. Now vomiting, I'm going to go with vomiting because I think that's going to be more likely than constipation or oliguria in this example. Here, I don't see lithium bothering those things. So these are my 4. I like 4 questions because they're easier for select all that apply. All right, there we go. So we got that one right. Let's move on. The nurse monitors a 20-year-old client with chronic alcoholism. The primary care physician prescribes disulfiram. The nurse is aware that the medication is contraindicated to the following conditions. Select 3 that apply. This pharmacology is tough. So disulfiram affects your mentation. So if you have any kind of compulsive obsessive disorders, you don't want to choose this. I'm also going to pick psychosis. And then now I have 2 heart conditions and a thyroid condition. I don't know if it affects the thyroid at all. So I'm worried about the 2 heart conditions. I'm just going to go with, I'm going to do a coronary artery disease. And I'm going to pray for partial credit here. It's either, when you have 2 heart conditions, you need to pick one of them in this instance. Maybe it's the psychosis. Let's see. Okay. Heart failure and coronary artery disease here. I shouldn't have picked the psychosis. I know that disulfiram does affect your mentation, but not in psychosis. So I'll remember that. Okay, another challenging Pharm. The nurse is caring for a client diagnosed with asthma. To treat asthma, the following medications are indicated. Select to determine which of the medications has short or long-acting effects. Short, long, undetermined. Okay, so the undetermined is a distractor because we're only looking for short and long. So don't ever pick undetermined. All right, albuterol. What do you know about albuterol? We have to give that pretty frequently, so I'm going with short here. All right, make sure you choose short for albuterol. We have salmeterol, formoterol, levoalbuterol. Okay, so albuterol is short-acting. Salmeterol is long-acting. Formoterol is also long-acting. You kind of see they're kind of the same. And then levoalbuterol. If you pick short-acting for albuterol, I'm definitely pick short-acting for this because this has albuterol in it. So that's like a little trick for the trade here. It's all about repetition here. And we got this one right. Of course, we just kind of talked through that with content. But this is how you need to approach these next-gen questions. The QBank, how did we do? It's going to give us a score. Not bad, y'all. Not bad, y'all. Partial credit. Excellent job. If you want to get in the QBank, you don't have to wait for me. Go to remarners.com, click on whether you're RN or PN, and you will get your workbook, your QBank, your lecture contents all in one. The June discount is ending soon, so make sure you get in that QBank. It's the second icon to the left. See you inside.